Hi, this is my practice video for my second educational in-service. To start off with, I'm going to do a little bit of a review of my first educational in-service. And my first educational in-service focused on impending signs of violent behavior. Some of those signs include flushed or pale face, excessive sweating, clenched jaws or clenched fists, pacing or other repetitive movements, change in voice volume or tone of voice, glaring or avoidance of eye contact, as well as change in facial expressions. Some other signs could be the patient states that they feel anxious or they feel fearful. They could be argumentative with staff. They could be invading the staff's personal space. And some tips to avoid an act of violent behavior would be to talk to the patient or the visitor in a quiet, low-stimulus environment and actively listen to the patient or visitor. Ask narrative questions. Don't just cut them off with a yes or no question. Maintain full eye contact and let the patient or visitor tell their full side of the story before giving your own opinions. These could all be things to help avoid a violent situation. Next, I'm going to move on to my second in-service, and I'm going to go over risk factors for potential violence, preventative measures for violence, as well as ways to de-escalate in the situation that there is violence. So first, there's a few risk factors that put healthcare workers at risk for violence, and that is working with the general public. We handle pharmaceutical drugs, valuables, etc. Those are things that are going to put us at risk for violence. Working near premise where alcohol is served, working in community-based settings such as a hospital, working late hours or early morning hours, or near or on the holidays. Those are all things that can put us at risk for violent behavior from patients or from visitors. And there's a few things that we can do just to try to prevent violence from happening, just some, basic things. Always have an exit and keep nothing between yourself and the exit. You stay between the door and the patient. Only go into areas with adequate lighting at night or areas that are security guarded. If you feel uneasy or that you don't want to walk alone, you can always ask for an escort. As well as using the buddy system, which is what I myself and some of my other coworkers do. We like to use the buddy system. We never walk in alone from work. We never walk out alone from work. And it seems to work pretty well. And never enter a situation where you feel unsafe or if you feel threatened. And then if violence is imminent and there's, you haven't been able to avoid it, these are ways to de-escalate violence. Use verbal communication techniques that are clear and calm. Staff attitudes must be non-confrontational and avoid using abbreviations or healthcare terms. You want to talk on that patient's educational level. Don't try to talk above them or talk down to them. Those are all things that could trigger a patient to be violent. As well as using non-threatening body language when approaching the patient. Approach the patient with respect, being supportive of their issues and problems. Always take them seriously. Don't try to decrease the value of their problem. Respond to the patient's expressed problems or condition. This will help create a sense of trust. If you go to the patient and you blow them off, you act like their problem isn't important, then they're not going to trust you and they're going to continue to be violent. Set clear limits for patients to follow. Implement environmental controls such as minimizing lighting, noise, and loud conversations, which is kind of difficult to do in the emergency department. But if you have to, tell everyone around you to be quiet, like, this patient is being violent. And one of the only ways to stop them from being violent is to decrease the stimulus in the environment. And at this point, I would go through and ask, my coworkers if they have any questions, comments, concerns. When I go through each section, I may ask them, do you have any questions? Is there anything you'd like to add? They're going to be presented a handout. We're going to talk through the explanations as long as they're willing to let me tape them. And also have a video to share with them, which I'll share with you now.
I've got to reschedule because of your screw-up. I have an appointment now, and I'm going in now.
Mr. Warren, I really can't let...
Workplace violence is a serious safety issue. Some 2 million American workers are victims of workplace violence each year. It can surface in the form of verbal threats or even physical assaults. But no matter how workplace violence manifests itself, it is undoubtedly a growing concern for employers and employees alike. Here are 7 tips to prevent workplace violence. Assess your work environment. Critically examine all areas of your work environment, including parking lots, entryways, reception areas, work areas, and offices. Is the lighting adequate? Are there convenient escape routes? Do you have a method to summon assistance? Pay attention to the warning signs. Many people who become violent communicate their intentions in advance. Threats from customers, coworkers, or third parties should be reported immediately. Promote respect. The best way to prevent violence in the workplace is to foster a day-to-day attitude of respect and consideration in your work environment. Eliminate potential weapons. Take a mental inventory of objects available in your immediate work area that could be potential weapons. Remove or secure objects that could be thrown. Know your violence response procedures. Violence response procedures are simple plans designed to minimize injury during a violent incident. These procedures should include a plan to summon assistance and move people to a safe area. Trust your instincts. Don't ignore your internal warning system. If you sense impending danger, react accordingly. Use a team approach. If you are in a situation where hostility could occur, use the buddy system.
That was just a short video clip that I chose, actually because our facility uses CPI. That's what the video was taken from, was Crisis Prevention Intervention. So that's one of the reasons I chose the video. After I showed the video to them, I would ask if there's any further questions, if there's anything else I can, do to assist them. I'll keep extra handouts with a link to the YouTube video on the handout, and the extra ones will be kept in the break room. So that's pretty much it. Thanks. Bye.